Folks, we're here today to talk about an issue that is really about as simple as it gets. There is a virus in Central America that has been spreading northward and that has devastating impacts for women and especially for newborn babies. We know it's coming to our country, and as the weather's getting warmer, our nation's top medical experts say we must pass funding on an emergency basis to make sure that we are ready and that we are responding. These doctors aren't Democrats, they're not Republicans, they are doctors, and they know how to deal with viruses, and they know how to keep our families and our country safe. So along with the wonderful people who are here with us today, I find it extremely difficult to understand how we could just ignore the advice of the CDC and our best medical experts. Unfortunately, though, that's what we're dealing with here in the Senate as we go into Memorial Day, which is the official start of summer and the start of mosquito season. Congressional Republicans are simply refusing to deal with a virus that we know is spreading and spreading rapidly. That's why we're here with a remarkable group of moms and babies and America's favorite source of advice and insight and leadership for pregnant moms and families, Heidi Murkoff, author of What to Expect When You're Expecting, which Annie and I spent many, many hours poring over as we anticipated all three of our kids. And she's here to talk about what we're facing, and in particular, what expectant mothers will face if we don't do our job and make sure that we are ready to deal with the Zika virus.
First of all, I want to thank you, especially, for bringing us all here today, and all of you for being such passionate advocates for moms and babies, and all of you here who are willing to speak up and speak out and listen up for moms and babies. You know, I always say that motherhood is the ultimate sisterhood, and I say that because no matter where we go in the world, no matter what our religious or racial or cultural or political profile, all moms want what's best for their babies. All moms, and I venture to say all dads, want to keep their babies safe and protected and nurtured. So I think we can all agree with the basic premise that every mom deserves to expect a healthy beginning for her baby. We are our sister's keeper, and we all share a collective responsibility for her health and well-being and the health and well-being of her baby. That is not a partisan issue. That is a fundamental human issue. But if we agree on that, then I've just got to wonder why Congress isn't acting promptly and fully to live up to that universal, sacred responsibility of protecting moms and babies, of putting moms and babies before politics, which is where they belong, after all. And this is something that I also say a whole lot, and it's worth emphasizing because it's endlessly true about endless issues. Family values should value families. And as a mom and a grandmother and a lover of moms and babies and families, I recognize that I might be a little biased on this subject, but it's a good bias to have. And believe it or not, it's the most fiscally responsible bias to have. Because if you think about it, there is no better investment in our future than in their future. Our future depends on healthy beginnings for every mom and every baby. And the Zika virus threatens those healthy beginnings and that healthy future. And it's already devastating moms and babies in Latin America and in the Caribbean and in the US territory of Puerto Rico, and that is no fault of their own. And that's unacceptable. But far more unacceptable would be Congress not moving forward on passing the funding urgently needed to fight this terrible global public health emergency. So what's in the funding bill for us? We've all seen the photos from Brazil of moms clutching babies with tiny heads and irreversibly damaged brains, and they've tugged at our hearts. But imagine for a moment that was you, or that was your wife, or that was your daughter, or your sister in that tragic picture, instead of a nameless mother thousands of miles away. Imagine that unspeakable pain, and now imagine not just one or two, which would be tragic enough, but imagine hundreds or thousands of moms and their babies suffering the same fate, the same devastating beginning, the same heartbreaking future. One that would almost certainly cost our economy exponentially more than full funding of a comprehensive bill would now, and of course take an even greater human toll. And now imagine that we stood by and we didn't act to protect them. As a member of the human family we all belong to, I just can't live with that possibility. So I know there's been a lot of debate about Zika funding, but what I can't figure out for the life of me is why? There is no debate. There should never be a debate when it comes to the health and safety and well-being of moms and babies, our moms and babies. They must always be our top priority. And that's why I've been actively speaking out every chance I get about the urgency of passing critical funding for Zika research and prevention. And that's why I've worked so closely with the CDC and HHS and the White House in pushing out the message and trying to push Congress out of inaction. We need prevention, we need preparedness, we need precautions, we need perspective. We do not need to panic, but panic is exactly the outcome that we can avoid by acting now. We need facts and we need funding. As Dr. Fauci and Dr. Frieden and all the expert public health heroes who know way, way better than we do when it comes to infectious diseases have made clear, we need full funding. We need to learn what we don't yet know about the Zika virus. The alternative is unimaginable. We can't wait. We can't keep moms and babies waiting. I know we all share a passion for healthy moms and healthy babies with healthy beginnings and bright, healthy futures. Now we must share action. I ask Congress to act on behalf of moms and babies at risk from Zika to protect them as though they were their own, because they are. Moms and babies are depending on us. Let's not let them go down. Now, coincidentally, my husband and I are traveling to Sierra Leone next week with our amazing partners, International Medical Corps, to see how the horrific Ebola epidemic has devastated maternal and child health there. And it just strikes me how ironic it is that we now contemplate taking funding from one tragic public health crisis that has left moms and babies devastated to put a Band-Aid on another that has the potential to do exactly the same thing. That's not okay in my book. Thank you.